The connection between the Deprivation of Liberty Safeguards and the Mental Health Act is kind of sorted out with the fact that you have to have a mental health assessment during the DoLS authorisation process. That assessment will tell you that your health condition is one that is a mental health condition that warrants treatment under the Mental Health Act, in which case only the Mental Health Act will apply, and you can't deprive someone of their liberty and treat them for a mental health condition using the safeguards. It can only be done when they are under the Mental Health Act, or as they say, sectioned under the Mental Health Act. It is possible that when someone's near the end of their treatment and is about to be discharged from their mental health section, but their placement isn't quite available, they may be able to keep you on the premises using the Mental Capacity Act and the DoLS process. But it should really only be for a short length of time, and it mustn't involve the treatment of the person's mental health condition. It may be also that, well, as with the Mental Capacity Act, you can deliver medical treatment for a physical condition outside of a mental health unit in a general hospital, but because of the nature of your not having capacity, and that the hospital may need to keep you there so that you don't run off halfway through treatment, they can use the Deprivation of Liberty Safeguards to say that you have to stay there. But the Act again doesn't authorise treatment for your physical condition. It's just so that the treatment they give you has the best chance of working. For instance, a person was taken from a mental health unit to General Hospital to have an eye operation. They weren't normally under section in the hospital for their mental health condition, but this was a physical condition, so they were gone in there and they were being treated for the eye condition. The lady in question actually didn't understand that rubbing her eyes or meddling with her eyes would actually be damaging to her. So they needed restraint, not only to keep her in the hospital and stop her leaving, but also a form of restraint like special mittens and goggles so that she wouldn't damage the eye. They said they could repair the damage, but she would have to be restrained for a short period afterwards, and the Deprivation of Liberty Safeguards was used for that. I'm often asked whether the Mental Health Act trumps the Mental Capacity Act or the DoLS authorisations, and the answer to that is only if the care and treatment you need is for a mental health condition. Therefore, and then all the regulations are done, and the care and treatment you receive is done purely under the Mental Health Act. Other than that, it can be, that's all you need to do. So mental health issues that need treatment under the Mental Health Act, it is the Mental Health Act that takes precedence. You cannot use Deprivation of Liberty Safeguards to keep someone in a unit. If you are receiving or need to receive medical treatment that isn't for a mental health condition, but you lack the capacity to send, and you might normally be in under the Mental Health Act for your mental health condition, then the Mental Capacity Act can't be used. So if you're receiving treatment, a serious medical treatment problem for a physical ailment as opposed to a mental health ailment, then the Mental Capacity Act has the precedence, or is the way that you can follow the process in the best interest of the individual.